Is fatty liver dangerous? How can you recognize the early and advanced symptoms of hepatic steatosis, a silent yet serious threat? What are the key signs indicating that the fat in your liver has reached concerning levels? And more importantly, what steps can you take to eliminate this fat before it becomes too late? Today, we delve into the topic of fatty liver disease, a condition that is rapidly increasing worldwide. In the 1990s, hepatic steatosis was relatively rare. Nowadays, it is far more common than you might realize, even affecting children. In the United States alone, over 30% of adults over the age of 35 are afflicted. This is not a benign condition. Untreated, it can lead to liver scarring, cirrhosis, and even liver cancer. To grasp the severity of this issue, consider that hepatic steatosis is one of the leading causes of liver transplants globally. Ignoring this condition is not an option. Timely detection is crucial because the liver possesses a remarkable ability to regenerate, but only up to a certain point. By recognizing the signs and symptoms early, you can halt the disease's progression. Remarkably, you can even reverse fatty liver, restoring your liver to a healthy state. But it's not just about recognizing the symptoms. Understanding the main dietary causes of liver fat is essential. If you suspect or know you have fatty liver, avoiding certain foods entirely is imperative. I'll also share how you can naturally combat this condition through lifestyle changes. Surprisingly, some of the best remedies for fatty liver might already be in your kitchen, not in your medicine cabinet. So, let's get started. What are the 17 symptoms of fatty liver that you cannot afford to ignore? We'll explore 6 initial symptoms and 11 more severe complications, underscoring the urgent need for medical attention. First, a crucial point: hepatic steatosis is often silent. Many people discover they have fatty liver by chance during an ultrasound or a blood test conducted for another reason, where elevated liver enzymes such as AST and ALT are detected. This can be shocking, especially since early-stage hepatic steatosis does not exhibit symptoms similar to other conditions like diabetes, high cholesterol, or high blood pressure. But don't despair if you've been diagnosed with this condition. In its initial phase, fatty liver disease can be completely reversed, thanks to the liver's incredible regenerative capacity. So, were you really feeling nothing at all? Let's go to the symptoms. 6 initial symptoms of fatty liver. First initial symptom: stomach pain and heartburn. A study from UFMG revealed that individuals with hepatic steatosis often experience dyspeptic symptoms such as heartburn, burning sensations that extend from the chest to the throat, belching, and a persistent feeling of a full stomach. These symptoms occur significantly more in individuals with fatty liver, 25% compared to 12.4% in those without the condition. Second initial symptom: excess gas. Those suffering from hepatic steatosis frequently deal with excessive gas accumulation. Radiologists have noted that the presence of fat in the liver can contribute to this issue, sometimes even hindering the visualization of the pancreas during exams. This excess gas is likely due to changes in the intestinal flora, which directly impacts liver health. Third initial symptom: pain on the right side of the abdomen, near the ribs. This discomfort is often felt in the upper right quadrant where the liver is located, manifesting as a nagging pain under the rib. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. Fourth initial symptom: loss of appetite. Loss of appetite among those with fatty liver can stem from metabolic changes, liver inflammation, and hormonal imbalances. Symptoms like nausea, abdominal discomfort, and psychological impacts contribute to a reduced desire to eat. These factors, linked to impaired liver function, disrupt the regulation of hunger and overall well-being, underscoring the need for medical follow-up and proper management. Fifth initial symptom, fatigue. The liver, an essential organ, plays a crucial role in metabolizing nutrients and generating energy. However, the presence of fat in the liver can significantly impair these functions. Moreover, steatohepatitis, a condition where liver inflammation accompanies fat accumulation, can intensify feelings of tiredness. This liver dysfunction also affects hormone production, impacting mood, sleep, and overall energy levels, leading to persistent fatigue. Sixth initial symptom, nausea. Nausea in cases of fatty liver or hepatic steatosis arises from various reasons linked to impaired liver function. The liver's reduced ability to filter toxins leads to the accumulation of harmful substances in the blood, causing nausea. Additionally, excessive fat in the liver can result in inflammation, bringing about abdominal discomfort or pain accompanied by nausea. Liver dysfunction also impacts digestion, particularly bile production, which is essential for fat digestion. Finally, liver enlargement can press on the stomach and other organs, creating a sensation of fullness and nausea. These symptoms reflect an inadequately functioning liver and typically suggest initial hepatic steatosis. Now, what are the 11 late symptoms of fatty liver that you cannot ignore? First late symptom, dark urine. In hepatic steatosis, the urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color, similar to cola. Second late symptom, white nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail coloration occurs due to changes in blood composition and circulation often associated with liver diseases. The liver's inability to process and eliminate toxins efficiently affects various systems, including the blood circulation under the nails, leading to pale or white nails. Third late symptom, red spots all over the body. When the liver fails to produce essential proteins for blood clotting, it can lead to a decrease in platelets known as thrombocytopenia and problems in the absorption of fat-soluble vitamins, including vitamin K. This deficiency is vital for clotting, and as a result, red spots may appear on the skin, signaling these hepatic problems. Fourth late symptom, spider veins. Hormonal imbalances caused by liver issues can lead to an increase in estrogen, which is not adequately processed. This excess estrogen causes the expansion of blood vessels, resulting in spider veins. This symptom indicates a problem with hormonal balance affecting blood circulation. Fifth late symptom, itching all over the body. In advanced liver disease, bile salts accumulate in the blood and deposit on the skin, causing intense itching. This itching is more common on the palms of the hands but can spread all over the body, causing significant discomfort. Sixth late symptom, jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, biliary obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. Seventh late symptom, pulmonary erythema. Pulmonary erythema occurs due to the dilation of blood vessels in the palms of the hands. This characteristic redness can reflect various conditions, including hormonal changes or liver problems like hepatic steatosis. Damaged liver function leads to a hormonal imbalance causing blood vessel dilation. Eighth late symptom, pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, which are essential for stool coloration. As a result, stools become paler, reflecting the liver's difficulty in performing its normal functions. 9th late symptom, night blindness. Night blindness, or nyctalopia, can occur due to poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. Liver disease compromises this ability, leading to a deficiency that affects vision in low-light conditions. 10th late symptom, gynecomastia. Gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis. The accumulation of fat in the liver interferes with the hormonal balance between estrogen and testosterone, leading to the development of feminine characteristics such as gynecomastia. 11th late symptom, pain on the right side of the abdomen, near the ribs. This discomfort is felt in the upper right quadrant where the liver is located. The liver's increased size can press on the phrenic nerve, causing pain around the right shoulder as well. This pain reflects the liver's enlarged state and underlying issues. That's why it's crucial to recognize the symptoms and address them promptly, even if you don't have any symptoms but possess risk factors for hepatic steatosis. How can you determine if you have fatty liver? Early detection of hepatic steatosis allows for complete reversal, safeguarding the liver from damage. Even when scars and fibrosis are present, progression to more severe issues like cirrhosis and liver cancer can be prevented. Diagnosis typically involves imaging tests such as ultrasound, CT scan, or MRI. While it's normal for the liver to contain a small amount of fat, exceeding 5% of its weight prompts noticeable changes in the images, indicating excessive fat accumulation in the liver. There are 3 degrees of hepatic steatosis: Grade 1, mild steatosis; Grade 2, moderate steatosis; and Grade 3, characterized by a large accumulation of fat in the liver. Who is more likely to develop fatty liver, and what are the risk factors? First risk factor, obesity. Obesity significantly increases the risk of hepatic steatosis, where excess fat accumulates in the liver. This excessive fat impairs liver functions and causes inflammation. Over time, this inflammation can worsen, leading to scarring of the organ. This scarring is worrisome, as it can progress to more serious conditions, including hepatic cirrhosis, severely compromising liver health and its essential functions. Second risk factor, type 2 diabetes. Individuals with type 2 diabetes face a higher risk of developing hepatic steatosis, a condition linked to insulin resistance, a central aspect of this disease. This resistance results in an abnormal accumulation of fat in the liver, negatively affecting its functions. This situation can progress to liver inflammation, increasing the possibility of more severe liver damage. Third risk factor, high blood pressure. People with high blood pressure have a higher risk of developing hepatic steatosis, as hypertension can contribute to the accumulation of fat in the liver. High blood pressure often coexists with other risk factors like obesity and insulin resistance, which together exacerbate the possibility of liver damage. Fourth risk factor, excessive alcohol consumption. Excessive alcohol consumption significantly increases the risk of hepatic steatosis. Alcohol is metabolized in the liver, causing oxidative stress and inflammation. This process leads to the accumulation of fat in liver cells, impairing their functions and potentially evolving into more severe conditions, such as cirrhosis and liver failure. Fifth risk factor, sedentarism. Sedentarism increases the risk of hepatic steatosis, as a lack of physical activity contributes to the accumulation of fat in the body and liver. Physical inactivity is also associated with other risk factors like obesity and insulin resistance, exacerbating the likelihood of liver damage. Other causes include the use of medications like amiodarone, diltiazem, tamoxifen, and corticosteroids. What can be done to reverse the fat in your liver? Essential steps to reverse fatty liver disease. First, exercise regularly. Currently, fatty liver has become a common problem in children, partly due to lifestyle changes. In the past, children remained active despite an inadequate diet, engaging in activities like riding bicycles. Today, the preference for electronic games has replaced actual physical activities. To combat this, it's recommended to engage in walks or other moderate activities for at least 150 minutes per week. Second, lose weight. By losing 5% of your weight, you can achieve significant benefits for your liver health, including reducing inflammation, fibrosis reduction, and decreasing hepatic fat, thus improving your overall health. Third, avoid alcohol. Reducing or avoiding alcohol consumption is essential to protect the liver. Alcohol damages liver cells, known as hepatocytes, and can lead to the accumulation of fat in the organ, compromising its function and health. Fourth, maintain a healthy diet. The health of our liver is closely linked to our diet. Often, an inadequate diet leads to fat accumulation in this organ. Fortunately, a balanced diet can be the key to reversing this condition. What are the 5 most toxic foods for your liver that you should avoid at all costs if you have fatty liver? First, ultra-processed foods. These include packaged foods and fast foods, which are detrimental to liver health. Avoiding ultra-processed foods is crucial to prevent fatty liver, as they contain high levels of sugars, saturated fats, and additives that increase the risk of hepatic steatosis. Second, refined wheat. Foods such as bread, pasta, and crackers increase fat in the liver. Avoiding refined wheat helps prevent fatty liver, as it can rapidly elevate blood sugar levels, contributing to insulin resistance and the accumulation of liver fat. Third, foods containing fructose. It's important to clarify that fresh fruits are not included. The biggest villain of all, causing the most fatty liver, is corn syrup and fructose, found in sodas, cereal bars, boxed juices, tomato sauce, ketchup, mustard, and jellies. Fourth, sugar. To maintain liver health, it's essential to reduce sugar consumption, including fructose. Sugar significantly contributes to fat accumulation in the liver, raising the risk of developing hepatic steatosis, a condition that negatively affects liver function. Fifth, vegetable oils. Today's diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It's advisable to avoid vegetable oils, as many are rich in omega-6 fats, which in excess can promote inflammation and contribute to the accumulation of fat in the liver. And now, the 6 foods you should include in your diet to cleanse the fatty liver. First, turmeric. Turmeric, known for its anti-inflammatory properties, should be consumed with a pinch of black pepper to enhance its absorption and effectiveness in our body. Second, whole grains. Whole grains such as oat bran, flaxseed, and chia are rich in fiber and omega-3 and are associated with a reduced risk of hepatic steatosis. Third, coffee. Coffee, containing caffeine, tocopherol, vitamin E, and chlorogenic acid, acts as an antioxidant, reducing liver inflammation and offering protection against liver fibrosis. Fourth, olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver, promoting an improvement in liver health. Fifth, fruits. Research indicates that fruits, especially avocado, are effective in reducing liver fat. Avocado stands out due to its high content of glutathione, a powerful antioxidant that fights fat in the liver and promotes broader liver health. Sixth, cruciferous vegetables. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk, thanks to its sulfur derivative. If you have fatty liver, follow these guidelines. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.